Bell's palsy. Bell's palsy is characterized by acute paralysis of the face due to inflammation and swelling of the facial nerve within the facial canal or at the stylomastoid foramen. It is a lower motor neuron disorder, usually occurs unilaterally. The exact etiology is not known, but it may be associated with viral infections. For example, herpes simplex and the varicella zoster. Pathophysiology of Bell's palsy: inflammation of the nerve, that is the facial nerve, is seen due to infection or due to some immune cause. Clinical features of Bell's palsy: the onset is acute, intensity of pain is variable, pain and weakness around the mastoid process and develops over 48-hour period, impairment of taste and salivation. Bell's phenomena is when the eyeballs rotate upwards and outwards on attempting to close the eyes and show the teeth. Facial muscle paralysis on the side of palsy, drooping of the corner of the mouth, effacement of creases and skin fold on the affected side, weakness in frowning and eye closure, drooling of saliva from the angle of the mouth. Angle of the mouth deviates away from the side of the lesion on asking to show their teeth. Corneal ulceration due to inability to close the eyes, increased tearing, and lack of taste. Investigations include electromyography, ESR, X-ray, CT scan to rule out tumors, serological test. Schirmer tear test reveals decreased flow of tears on the side of palsy and SD curve. Differential diagnosis includes GB syndrome, Lyme's disease, and the Ramsay-Hunt syndrome. Scales or outcome measures which are used to grade facial palsy. The first one is House-Brackman grading system. Here, grade 1 is normal. Grade 2 is mild dysfunction, which means slight weakness. Grade 3 is moderate dysfunction, where there is obvious weakness, no disfiguring, and the eyes can be completely closed with effort. Grade 4 is moderately severe dysfunction, wherein we see obvious weakness, disfiguring asymmetry, and incomplete eye closure. Grade 5 is severe dysfunction, where it is barely perceptible motion is seen, asymmetry at rest. Grade 6 is total paralysis, where there is no movement at all. The other scale which can be used is the Sunnybrook facial grading system. Medical management for Bell's palsy includes prednisolone, acyclovir, antiviral therapy, and steroids. Treatment in the acute stage includes protecting the exposed eye during sleep and also using adhesive tapes to keep the eyes closed to prevent corneal ulceration. Physiotherapy management to relieve pain includes TENS, that is transcutaneous electrical nervous stimulation, and therapeutic ultrasound. For muscle re-education, electrical stimulation, massage to tone the facial muscles, mime therapy or neuromuscular training, PNF, that is proprioceptive neuromuscular facilitation for strengthening the muscles. Conventional exercises include elevation of the eyebrows, alternate closing of the eyes, saying A, E, I, O, U, smiling with or without showing teeth. Prognosis of Bell's palsy: 80% patients recover in 4 to 8 weeks without treatment. Incomplete paralysis indicates good prognosis. Complete paralysis, in this case, electrical absence of denervation on electromyography is an optimistic sign. Majority of the patients who recover show signs of crocodile tears, where there is shedding of tears while contracting the facial muscles, that is during eating, drinking, etc.